just so that you know that I really do this. This is me and one of my dogs, Roxy. And so I do conformation showing, but I also like to do what my dogs are bred to do, and that's use their noses. And this is my dog, Buddy. And those are about 300 black truffles that we uncovered in a forest in Oregon. So, this is me when I'm all shiny. And this is me after I've been in the damp winter weather digging truffles. Patty asked all the speakers to kind of give their current perspective of a challenge that we see facing kind of our area, area of interest, and then kind of a strategy for that challenge. And so their perspective that I face is that traditional spaying and neutering of dogs can result in long-term adverse health problems, which some of the audience members have already mentioned. And I've just listed some systems that we know can be adversely affected from removing the gonads. And so specifically what I'm talking about is removing the gonads here. And if you don't know what gonads are, it's ovaries in girls and testicles for boys. And so in order to kind of explain what's going on, I have to give you a bit of a biology lesson. So I apologize in advance. We talk about this reproductive axis that occurs in animals between the brain and their gonads as the hypothalamic pituitary gonadal axis. So it starts with the hypothalamus, which is a very old part of the brain, part of the reptilian brain, if you will. So very conserved among species for millennia, right? And within the hypothalamus, there are certain cells that produce this hormone. It's considered to be the master regulator of reproduction, gonadotropin releasing hormone. But we just call it GnRH because that other thing is a really long word. And GnRH travels through a very small circulatory system that is just between the hypothalamus and the pituitary gland in the brain. It's called the portal system. And so you don't really find high levels of GnRH in the bloodstream if you were to take a blood sample from an animal, because most of it just stays circulating in the brain. And so the GnRH goes to the pituitary gland, which most of us have heard of pituitary gland. Specifically, for those purists in the room, it's the anterior pituitary gland. But when GnRH binds to its receptors in the anterior pituitary gland, it induces a release of two hormones. Follicle stimulating hormone, FSH, which isn't part of my story, so I'm just going to leave it out altogether. But I want you to know that I do know that it does that. And luteinizing hormone, all right, or LH. So we're just going to call it LH. So LH, because it's released from the pituitary gland, it goes into circulation, and it goes to where its target is, its main target being the gonads. There's receptors for LH on the cells in the ovaries, on the cells in the testicles, and when it binds to those cells, it releases gonadal hormones. So we think of estrogen, progesterone, testosterone, and then those hormones can travel through the circulation, through the blood-brain barrier, and negatively impact or decrease the secretion of GnRH and LH. And so by doing this, the hormone system stays in balance. When GnRH pulses up, LH pulses up, that causes testosterone to pulse up, which causes GnRH and LH to fall down, and then the whole thing happens over and over again. And this works perfectly until what? Until you remove the gonads, right? Because what happens when you remove the gonads is you still have GnRH causing LH to be released, but there's no negative feedback. So then what happens is you have a crap ton of LH. And what do I mean by a crap ton? Okay, so at the time of the LH surge in a female dog, LH concentrations are around 1 to 2 nanograms per mil. So that doesn't seem like very much, but that's kind of the limit of our detection with our in-clinic little LH assays that we have. When we measure LH levels from spayed and neuter dogs, very often it'll be in the double digits, sometimes in the 90s. And how long does LH remain elevated in intact dogs? Not very long. It goes up and then comes right back down. Goes up and then comes right back down. The surge, the very highest level that we see in an intact dog at the time of the LH surge, right before ovulation, that's 1 to 2 nanograms per mil. How long does LH remain elevated in dogs when they've been spayed and neutered? Forever. Forever. And forever and ever and ever, it's going to be as high as it could possibly be. Way higher than God ever meant it to be. And we've done this. We either do it by choice or by force when our dogs have their gonads removed. And for the cat people in the room, I can talk about cats when we're done if you're interested. The story on cats is different. Cats are not small dogs, and so because it's different, I'm going to save my time to talk about them later. So we talked about how LH levels are high, and we have known as biologists that LH levels are high after the gonads are removed for decades, for probably as long as we've been able to measure LH, so almost a century. I mean, in the 1920s was when they first measured LH. So we know that LH levels are high, but nobody ever thought it was a problem because they thought, well, the receptors for LH are only on the gonads. We took the gonads out, there's no problem because the receptors aren't there. And so, again, just to step back here onto biology, what is a receptor? What is this person talking about here? So when we talk about hormone action, it's kind of like a key and a lock, using the lock as the receptor and the key as the hormone. So in order to open the door, you need to put the key in the lock in order to open the door. And so if you just have a whole bunch of keys and no locks, then you're not going to do anything. If you just have a whole bunch of locks and no keys, you're not going to do anything. But if you have a whole bunch of keys and there's a whole bunch of locks out there, then a whole lot of stuff is going to happen. And that's what we found out, actually, is that there are LH receptors present in a lot of different parts of the body. So this is just a kind of a confusing slide, but what I'm trying to show you on this is that when LH binds to its receptor, that's the little squiggly thing here on the top, it does a lot of stuff inside the cell. And some of those things it does inside the cell stimulates cell proliferation. And cell proliferation is good if you're trying to grow a baby, but it's really bad if you're trying not to make cancer. And that's why we see LH as being a very high promoter of cancer development, because these receptors for LH and its ability to stimulate cell proliferation. So as I mentioned before, we know that there are LH receptors present all over the body. So in the urogenital tract, in bone, so subchondral bone, in ligaments, in the adrenal cortex, in the skin, hair follicles, in B and T lymphocytes, and also in blood vessels. So this is a talk that I normally give over a 2-hour period of time, and I try to truncate this to just, less than an hour. And so I took out a whole bunch of information, and I just really am focusing on a couple different disorders and a couple different neoplastic conditions. I'm going to start with urinary incontinence because I think of all of the problems that are been linked to spaying dogs. This is probably the one that has the most buy-in by people. And so when female dogs are spayed, there is the risk for them to develop what is often referred to as estrogen-responsive urinary incontinence or spay urinary incontinence. It doesn't happen in every dog, but it doesn't have to. All right, because that's biology. I mean, we see animals respond differently to medications. We see them respond differently to training methods. So why would we expect them to respond the same for something else? We see we do see this problem occur more commonly in medium to large breed dogs, and we don't understand why that is the case, but that does seem to be true. And there's been a lot of discussion whether this is related to the age of sterilization or what is removed. Let's say you just remove the ovaries. Is it just as likely to result in incontinence? Yes, the answer we know that is to be yes. What if you delay spaying until after puberty versus before puberty? Does that reduce the incidence of urinary incontinence? No, it doesn't. But the problem is that we see urinary incontinence develop sometimes within 3 weeks after they're spayed, and sometimes it's 9 years after they're spayed. So if that dog was prepubertally spayed or spayed at 6 months of age, and it develops it at 9 years of age, how are you going to really say that, did that 4 months that you delayed really made a difference? I know that, again, this is commonly referred to as an estrogen responsive condition, but I'm going to explain that more here in the context of LH in just a minute. There are receptors for LH all over the urogenital tract, as I mentioned before. This is a special kind of stain that we do in our lab. It's called immunohistochemistry, and everything that is red on this slide, those are cells that have LH receptors. So you can see along the top surface, that's what we would call the epithelium or the inner lining of the bladder, that has LH receptors. And then what is red staining, that is the muscle layer, the smooth muscle layer of the bladder, and that also has LH receptors too. And so, as I mentioned before, we see urinary incontinence develop, in dogs after spaying. There's been some research as to try to figure out why that is. And so, one group back in 2009 reported that after spaying, dogs they develop more LH receptors in their bladder, in their urogenital tract than before they're spayed, than dogs that haven't been spayed. And so now there's more doors, and there's lots of keys, right? Lots of LH around. Now there's more LH receptors, more likely to have an effect being leaking. And so how do we treat urinary incontinence? Well, typically, and this is before Proin, PPA came out, we would treat with diethyl stilbestrol or estradiol benzoate or some form of estrogen. And in most dogs, estrogen works very well to correct it. That's why we get the term estrogen responsive incontinence. But what is estrogen doing? It's lowering LH levels, right? Because then people have used a GnRH agonist to lower LH levels, and they become continent again. Our lab used a GnRH vaccine to lower LH levels, and the dogs became continent again. So we know that this it's not an estrogen problem. It is an LH problem. So this is the first LH disease that I talk about, because again, this is one that most people understand. They recognize that this is a problem. They know it's related to spaying, and so there's not much argument. So I want to talk about the skin next. And again, with this type of staining, wherever you see the red, those are where LH receptors are. So you can see, again, along the epithelial level of the skin, all those cells are red. They have LH receptors. These are in actually the hair follicles. You can see the cells lining the hair follicles all have LH receptors. And the reason why this is important is because, especially in coated breeds of dogs, so long-haired dogs, but it also happens in wire-haired dogs too, it changes their coat type, they can develop something that's called puppy coat syndrome. And as wonderful as that sounds, that you're going to have a puppy again, it's not good at all, because now you have this coat that's really likely to mat, and what's happening is that they can't shed properly. And so work that was done by Iris Reichler in Switzerland showed that when she took biopsies from skin samples from dogs before and after spaying, she found that what happens is that the hair follicles, instead of falling out at this early anagen phase, that they stay longer in this telogen phase. And so is that really a bad thing? Well, if your dog is more likely to mat or, have skin problems because it has this puppy coat syndrome, yeah, it's a problem. And so Dr. Reichler, who also did a lot of the work with urinary incontinence, used a GnRH agonist to lower LH levels, and surprise, their hair coat became like it was before they were spayed. So again, we know that this is an effect of high levels of LH. And normally we don't see this in dogs that are intact because even though there are LH receptors in the skin, it takes a lot of LH in order to do something about it. And you don't ever have LH levels that high in intact dogs. I'm going to talk a little bit about behavior just because it really rubs me the wrong way when people say they need to spay and neuter dogs because it will improve behaviors, because that is not what the science shows, and the science really has never shown that. So I really have problems with people telling me this. There are lots of LH receptors in the brain, and specifically in parts of the brain that are related to control behavior, so the hippocampus and the hypothalamus. And so while it is true that if you remove the testicles from intact male dogs, that their likelihood to fight with other intact male dogs will decrease. Removing the gonads is likely to increase dominance aggression, and that's been shown by at least 2 groups. It's likely to increase stranger-directed aggression. What do you think your veterinarian is, right? Stranger. And is more likely to increase owner-directed aggression. What's likely to result in the dog being relinquished to the shelter. So there's just some other breed-specific studies I want to point out here. Female dogs without gonads were twice as likely to become aggressive than dogs with gonads. There was an increase in owner-directed aggression in female dogs who had their gonads removed before 11 months of age and who had already shown some aggression behavior. So you can imagine that puppy comes in, shows some aggression, or the owner says, he's doing these behaviors at home, and the veterinarian says, spay her, and then that will fix everything. But actually, that's not what the science shows. The science shows that will actually make things worse. And then again, some breed-specific differences too. What I've been told by behaviorists, and I'm not a behaviorist, although I do breed dachshunds and I have to know a lot about behavior, is that behavior is a very, very messy subject. All right, lots of things can regulate behavior. So I want to I'm going to end my behavior talk about fear and anxiety because I think that fear and anxiety can result in aggressive acts too. They're fearful and they're going to react in a certain way. They're anxious and they're going to act in a certain way. And so there's been several studies now that have shown that spaying and neutering, so removing the gonads, increases fear and anxiety. And I know that our moderator said that 20% of the cases that we see coming in now are skin. I would say that at least 20% of the clients I have concerns about separation anxiety or some sort of behavioral problem in our clinic. And of course, we're doing lots of fear-free medication before they come in so that we can not get bit by that fearful dog when it comes into the veterinary clinic. But we see again this rise in fear. And so this was it was a study of one, all right? So this client's dog that was neutered and started to develop some pretty serious anxiety and fear behaviors that the owner was all like, I can't deal with this anymore. And because there were some other metabolic problems that were likely related to high levels of LH, we used a suprelorant implant to lower LH levels in this dog, and the behaviors went away. So again, a small sample size, but now what I recommend to people if they say, my dog was the happiest dog ever, and I tell you, I've heard this so many times. The puppy is the happiest dog ever. You see it at 9 months of age. It gets sterilized. It comes back in a year later. It's gained 30 pounds and is afraid of you, all right? No longer happy to be there. And so, is that related to high levels of LH or just something else. So I think just to kind of clarify terminology, when I talk about an LH surge, that's what happens just before ovulation. So that's only going to be in intact dogs. And so what happens after the gonads are removed is that LH levels rise and they just remain high forever. So it's not really a surge. It's just high forever. And again, I'm sure that you've seen from training too, is that it's not every dog. Why don't we see it in every dog? Well, it's just like urinary incontinence. I mean, if the incidence of urinary incontinence, depending on the study, they say is between 3 and 20%. I mean, 20% is high. I think the most accepted incidence for urinary incontinence is 5%, which most people say, that 5%. That's 1 in 20. That's like that's at least, if you're spaying 20 dogs at your clinic a month, at least one of those dogs every month, you're creating a lifelong problem, and that's just one of the many problems that high LH will cause. But anyway, so with respect to behavior, why would we expect it to be any different? Okay, so I'm going to talk about 2 cancers, and the reason why I'm picking on these 2 cancers is 1, hemangiosarcoma is a problem in my breed, dachshunds, and 2, I had a dog die from lymphoma, so that's the other one that I'm interested in. So I'm going to start talking about hemangiosarcoma. For those of you that don't know what this type of cancer is, it is a cancer of blood vessels. So that's pretty much sucks because there's blood vessels everywhere, right? I mean, on your skin, but the most common location we see it is the spleen. Why? Because there's a lot of blood vessels in the spleen. We also see it a lot in the skin. Why? There's a lot of blood vessels in the skin. And for some reason, which nobody can really understand why, the right auricle of the right atrium of the heart, we also will see hemangiosarcoma in that one part of the heart too. But again, spleen is probably the most, and that's this picture that's on the right is a splenic hemangiosarcoma. The classic case of a splenic hemangiosarcoma is that dog that's wagging its tail and panting, and you're like, "What's up, buddy?" And then they keel over. And you rush them in, and then, they live long enough to make it to the ER vet, for the $300 minimum exam fee, and then the belly tap just to find out that it's all blood and probably a ruptured splenic hemangiosarcoma. So fun facts with hemangiosarcoma, even with surgical removal, of course, you can remove a spleen, you can't remove the heart. So these are with splenic hemangiosarcomas. The mean life expectancy is less than 3 months if you don't do chemotherapy. If you do chemotherapy, you get about twice as long. So hardly worth it. Female dogs that have had their gonads removed, depending on the study, are 2 to 4 times as likely to develop splenic hemangiosarcoma as intact dogs, and 5 times more likely to develop cardiac hemangiosarcoma. So if you've had a dog that has had hemangiosarcoma, if you know that it's a problem in your breed, and you do anything that you possibly could to prevent it, you feed your dog only filtered water and organic food, why would you do anything that would increase the risk for that problem? So our lab, because we look at everything as though it's an LH disease. No, that's not true, but so I've been accused of that. We wanted to see if there were LH receptors present in the spleen. And as I mentioned before, we know that there's LH receptors present on blood vessels. So of course, there's lots of LH receptors in the spleen, and of course, in actually splenic hemangiosarcoma, lots of LH receptors. It's a little bit hard to see on this slide, but the cells that have the little arrows pointing to them, of course, that are red, those are cells that have LH receptors. And so we took cells. This is a study that was actually funded by the American Kennel Club Canine Health Foundation. We took cells from a dog with hemangiosarcoma, and we isolated the cells from the tissue and then grew them on a petri dish in the lab. And what you're looking at here, the blue are the cell nuclei. They're just fluorescing blue because of the stain we used. And the green is the LH receptor actually on the cell. You can see I've also got it with a red arrow, and I apologize for those of you that are colorblind, but it's the thing that's not blue. And so we previously demonstrated that there are LH receptors in splenic hemangiosarcoma, and we presented this information to veterinary groups. And people said, yeah, but there's lots of receptors all over the body, and they don't do anything. And so then our next challenge was to show that they did something, because we already knew that LH receptors in the bladder and the skin did something, because if you lowered LH, those problems improved. So we took these cells and we put them, again, in cell culture, and we added increasing amounts of LH to the cell culture media to see what would happen. And among other things, what we did was we induced cell proliferation. So if you have, this might be a surprise to you, but again, this is a biology lesson. At any one time, you have cancer cells in your body. All the time. Your body is trying to make cancer. And you have anti-cancer cells and proteins in your body that is stopping that cancer in its tracks. And so I always call this a balance, kind of between the pro-cancer and the anti-cancer camps in your body. And so when you get cancer, of course, you kind of, you lost that battle. You've got to do something else in order to get back, to fight the cancer. But your body's always, there's something always trying to stimulate cancerous development. And so when you have high levels of LH, and you have these cells already trying to become cancerous anyway, it's just like adding fuel to the fire. And so now you have cells that are being stimulated to proliferate faster than the body can stop the proliferation from happening. And so, as I mentioned before, I had a dog that died from lymphoma. He actually was my dog while I was in veterinary school, so human-animal bond. I mean, he got me through a lot of tough days. And then, he developed lymphoma. And, fortunately, I was a veterinary student, so part of the cost of his care was covered by the veterinary student discount, and then he waited to die until shortly after I graduated from veterinary school, so I didn't have to deal with that and pass my boards. We had already learned from a study that we did in healthy dogs that LH receptors were present on lymphocytes. Lymphocytes are a type of white blood cell. They're the type of white blood cell that makes antibodies. Those are B lymphocytes. Those are the ones that make antibodies. The T lymphocytes they don't use antibodies to evoke their immune function. They actually can directly kill the bad stuff. So they're like killer cells, cytotoxic cells. At any rate, we already knew LH receptors were present on lymphocytes. And in this study, very interestingly, we took blood samples from, again, intact dogs, male and female, and spayed and neutered dogs as well. And we ran the cells through a flow cytometer, stained the cells for LH receptors so that way we could differentiate between B and T lymphocytes and which cells had LH receptors and which cells didn't. And what we found was that there was an increase in LH receptor expression in B lymphocytes for male dogs. That's just kind of like a gee whiz compared to female dogs. And we didn't see that in T lymphocytes. But following spaying or neutering, we saw more dogs of both sexes having LH receptors in T lymphocytes compared to B lymphocytes. And the reason why I'm making this separation is that just like there are these two different types of lymphocytes, but they both cause different types of lymphoma. B cell lymphoma is easier to treat and has a better prognosis. T cell lymphoma is harder to treat, has a much worse prognosis. And so the fact that we see the problem, more T cells expressing it in spayed and neutered dogs was of significance. So as I mentioned before, canine lymphoma is a significant problem in dogs. It accounts for up to 24% of all cancer, so this is a very common type of cancer in dogs. Many studies have documented that gonad removal the dogs that have had their gonads removed have a higher incidence of lymphoma. Can't say that it causes it. We just say that we see a higher incidence in dogs that have had their gonads removed. And depending on the study, the one out of Davis you talked about, Torres de la Riva study, in male dogs, 1 in 10 of those dogs developed lymphoma. Right. Yeah, wow. Wow is right. So we took some biopsies from lymph nodes that had lymphoma, and we look for LH receptors. Again, what's red is cells that have LH receptors. You see a lot of red here. And so, again, we show this information to veterinarians. You shouldn't be spaying and neutering dogs. It increases the risk for lymphoma. And people would say, yeah, but those receptors probably don't do anything, right? And so then we took those cells, we took them out of the cancer tissue, we grew them on Petri dishes, and we wanted to see what would happen if we added LH to them. And instead of actually using LH in this study, we used a human kind of form of LH, if you would, human chorionic gonadotropin. So that's what HCG stands for. And you could see that with respect to gene expression, LH receptor expression, as you increase the amount of LH that is exposed to the cells, you have an increase in the amount of LH receptor expression. We looked at cell proliferation, and as the amount of LH present in the media increased, we saw more cell proliferation. Lymphoma, because these are white blood cells and they circulate through the body, one of the things that how cancer happens with lymphoma is the cell has to adhere to the blood vessel and then migrate through the blood vessel. And so the next functional assay we did was whether these cells were likely to adhere to a cellular matrix that we were also growing in culture. And we saw increased cell adhesion as we increased LH levels. And then we did this last study, which is called a cell invasion study, where we measured how many cells would actually invade through that cellular wall into another chamber of the Petri dish, if you will. And as we increased LH receptor activation, we saw an increase, except for the very highest level, 4,000, which it would never be that high in circulation. We actually, did something to attenuate the development. So I maybe preaching to the choir a little bit, but what my take-home message to veterinarians always is that the gonads, the ovaries and the testes, they aren't just these sacs that hold sperm and eggs and release some hormones and then are otherwise unnecessary, like your appendix. That the gonads actually have important physiologic function, and any postmenopausal woman would say, yeah, and those functions aren't just related to reproduction, right? It's related to normal metabolism, musculoskeletal health, behavioral health, and again, this balance between cancer, what I consider anti-cancer health. And so how do I make a positive impact, all right? The current problem, this is the positive impact. And so there are permanent surgical alternatives to spaying and neutering that you can control populations without causing health problems. And that's just easy. You don't remove the gonads, but you remove something else. And a hysterectomy, I think we all understand what that is. We're removing the uterus, but not the ovaries. And the vasectomy, again, I think we all have heard of that term before. And then we can use some method of hormone downregulation, but I'm just going to mostly talk about the surgical methods. So again, when I talk to veterinarians, I'll have people tell me that they wouldn't dream of doing anything other than spaying and neutering because it would be against the standard of practice. So veterinarians worry about this because if they are ever sued by somebody, they will be evaluated as what is the standard of practice? What is the standard of care? And so I always pull up this. This is the American Veterinary Medical Association methods for essentially reproduction control. It says spaying and neutering, and it doesn't include that at the top, but it also says In addition to that, or as an alternative, you could also do a hysterectomy or a vasectomy. So, and this, the first time I found this was 15 years ago, and it hasn't changed on the AVMA website since. So this isn't new information. Vasectomy, this can be done in puppies as soon as their testicles descend. Or it could be done laparoscopically before their testicles descend, but I don't recommend doing them when it's a month, they're a week old. I'm just saying that you could easily, at the time puppies go to their new homes, when they're 8 weeks old, that's typically when the boy puppies' testicles have descended, you could have vasectomies done on the boy puppies before they are placed into their pet homes, and then they would develop normally because they'd have hormones. They wouldn't be able to procreate because they've had a vasectomy. And if their new owners decide, I just can't deal with, X, him humping the pillow or him peeing on my backpack, or, you fill in the blank. I usually tell people if you could make it through a year with a belly band, then those problems just kind of go away as they get through their teenage years. But if they can't deal with that, you can always remove the gonads at a later time. You can always do something else. But once you've removed the gonads, there's no backsies, right? And so, how come more veterinarians don't do this? I don't know, because it's been in veterinary textbooks for 20 years. So it's not like it's not available to veterinarians. And of course, our veterinary college teaches it, but we teach it when we offer it on our 4th year rotation when clients request this particular surgery. So not every veterinary student will have an opportunity to watch one done.